and welcome to this YouTube video. My name is Claire Rusbridge and I'm a veterinary neurologist, and I have a particular interest in Syringomyelia. This is a condition of the spinal cord where fluid-filled cavities form within it, little pockets full of fluid, which damages the spinal cord structure and leads to a number of different clinical signs and pain. The subject of this YouTube video is the filling mechanism. That is to say, how does Syringomyelia form in the first place, and why do these pockets of fluids occur? And this is a subject that's really regarded as the holy grail in Syringomyelia research, because actually we don't know the precise mechanism of how Syringomyelia forms. There are a lot of theories, but nothing has been absolutely proven. So what you're going to hear today is really my take on it, and also the most accepted theories. So what is Syringomyelia? Well, Syringomyelia is described, as I've said in my introduction, as a fluid-filled cavitation in the spinal cord. And what you're seeing in this image is an MRI pictures of a Cavalier King Charles Spaniel in this instance, and there have been a number of pictures that have been put together to make a view of the entire spinal cord. In most circumstances the MRI wouldn't capture the entire spinal cord in a Cavalier. And you have to imagine that what you're seeing is if we have taken the dog and made a slice right down the middle of the dog's back. And you can think about MRI as making your body like a loaf of bread, where you can slice the bread in any direction that you want, and then take out those individual slices and have a look at the structure. And so what you're seeing in here is a midline section right down the middle of the dog. So for instance, this is the back of the brain here, and this coming all the way down here is the spinal cord. The dark bits either side of this are the vertebrae. That white bit on top is the fat on the dog's back. This dog is overweight. This is the heart. This is the windpipe. These are the abdominal organs, and that's a little bit of the belly here. And the salient feature in here is that the spinal cord should be a grey colour, but in this instance you can see white through it, and this is fluid actually within the spinal cord, and the spinal cord is expanded, it's filling with that fluid. And if we do a cross section right through here, so imagine that the spinal cord is like a pencil, and now that we've sliced through that pencil and we're looking at it end on, and we can see the spinal cord as a sort of round shape here, but it's only a very, very thin rim, because the centre of the spinal cord is all fluid, which on this MRI scan appears as white. Now, Syringomyelia can occur due to any obstruction of the fluid around the spinal cord, and that is called the cerebrospinal fluid, and you can think of the brain and the spinal cord floating in this fluid. It's incredibly important because actually the brain and the spinal cord weigh quite a lot, and if it wasn't floating in this fluid, then we humans wouldn't be able to put our head up, because our head is so heavy with our brain in it. Our brain is so heavy, and so this fluid is very important for suspending the nervous system in it, and it also is very important for protecting the nervous system, a little bit like the way that a baby is suspended in fluid in a pregnant woman. And like a baby is suspended in fluid, this is contained in a sac, and the sac is called the meninges in the case of the central nervous system. So there's a sac called the meninges which goes round the brain and the spinal cord, and in this sac is fluid in which the brain and the spinal cord floats. And it has to be a low pressure system, this, because the brain and the spinal cord is very sensitive, soft structures. But when you think about that, it's pretty incredible, because every time the heart beats, you have all of this blood going to the brain and the spinal cord. You know, something like 20% of your heart volume is going to your brain for all those necessary functions. So there has to be within the system a means of coping with that pulse pressure. And it's when that flow of fluid around the spinal cord, which is very important for controlling that pulse pressure, when it's obstructed, that you get syringomyelia forming. And the most common cause of syringomyelia is when there is obstruction here at the foramen magnum. And the foramen magnum is the big hole at the back of the spinal cord. But you could also get syringomyelia occurring with any obstruction along the length of the spinal cord, for example, due to a web across the space that the fluid is in, which is called the subarachnoid space, or even because the spinal cord is not able to move as much as it should because it's tethered too much at the bottom. So there is a number of causes of syringomyelia, which we will discuss in another YouTube video at some point. But the most common cause, and the one that we're going to talk about here in relevance to canine Chiari malformation, is when there is obstruction at the foramen magnum, when the fluid cannot flow through this junction very easily. So to understand syringomyelia, we have to understand the cerebrospinal fluid. And here's a thing. A lot of us were taught about cerebrospinal fluid anatomy, but actually this anatomy that we were taught is, well, frankly, incorrect. So what a lot of us were taught is that the cerebrospinal fluid is produced by a little gland that is in the present within each ventricle within the brain. And the ventricles are fluid-filled spaces in the brain, and we have two lateral ventricles, a third ventricle, which you can see here. You can just see the lateral ventricle there, and then the fourth ventricle here, which was really a slit. So there's a choroid plexus in each ventricle, and it produces cerebrospinal fluid. And that cerebrospinal fluid flows through the ventricular system, so it flows from the lateral to the third, through this little aqueduct here into the fourth, and then it comes out at the side through the lateral aperture. In humans, it can also come out through here, but although it looks like there's a space there, there's actually a membrane, a part of the meninges going across that space. So that is not an aperture in dogs and cats. But it is in humans. So actually, you know, that bit is true. The choroid plexus does produce cerebrospinal fluid. However, it's the amount of fluid that it produces is really not as much as a lot of us were traditionally told. So instead of producing all of the cerebrospinal fluid, it actually only produces 40%. But in this traditional explanation, the fluid flowed out, and then it came along the spinal canal in the subarachnoid space, and then it could be absorbed through lymph vessels in the sheaths around nerves, the perineural sheath. But this old-fashioned explanation said that much of it was absorbed through the arachnoid granulations, which are specialized collections of cells here shown in the sagittal sinus, so associated with this big vein-like structure going across the top of the head, and that these acted as little escape mechanisms for that cerebrospinal fluid. However, what I really want you to take on board in this little video is that this is not the main mechanism of CSF flow and circulation. So, in actual fact, the brain and the spinal cord produce the vast majority of the cerebrospinal fluid, and this is a product of the brain's metabolism, but it's also an important circulation which we call the lymphatic circulation, where fluid is circulating through the brain and helping to remove toxins, such as the toxin which is involved with Alzheimer's disease. And instead of being absorbed through these arachnoid granulations, these arachnoid granulations are only an overflow valve. Instead, the vast majority gets absorbed through the lymphatic systems, especially the nasal lymphatic system. So passing through the lymphatics going through the cribriform plate, and also the lymphatics associated with the big vessels at the base of the brain, and also as with the other theory associated with the nerves. And so this fluid movement is influenced by osmotic and hydrostatic forces, and if any of it is if anything is interfering with that absorption, then you will get build-up of CSF in that system, and you'll get ventricular dilatation and hydrocephalus. And so really one of the points that I'd like you to think about is what happens if you reduce the surface area of the nose. We talked about in the last YouTube video on canine Chiari malformation how brachycephaly was really important for the pathogenesis of canine Chiari and also for Syringomyelia, and that in particular reduction of nasal tissue seemed to be important. So one of the theories is that in these very brachycephalic dogs, we put them into a state that is pro getting hydrocephalus and Syringomyelia. And in fact, in experiments in sheep, where they've tried to recreate these sorts of conditions, one experiment, they put a cement in these poor sheep's noses so that fluid couldn't absorb through that mechanism, and they found that when they did that, it didn't actually result in Syringomyelia until they put a constriction around the craniocervical junction by actually making a suture around that area and constricting the flow through there. So it seems to be that in Chiari malformation, what might be very important is having obstruction in the fluid flow through this region, and also being in a state where it makes it more likely by having reduced reabsorption of that cerebrospinal fluid through those nasal passages. Now at this point, if you haven't looked at the video on the canine Chiari malformation, you might want to go back and have a look at that first. But just as a reminder, what we see with canine Chiari is a kind of spectrum of disease, with actually some dogs regarded as normal for their breed, still having it to a mild degree. And what these diagrams are really showing is as a dog moves towards having Syringomyelia, their brain becomes more and more round. So it starts off as a sort of football shape, or if you're watching in it starts off as a rugby ball shape, or if you're watching in America, an American football shape. And as the dog becomes more and more likely to get Syringomyelia, then this shape becomes more and more round, so like a soccer football shape. And that's the main change. So you can see here that this red line here is corresponding to the nasal passage, and you can see how this nasal tissue is being reduced. See the red line here, and how the nose muzzle area, this is all nasal mucosa, becomes progressively reduced. We can see how the brain tilts, it's pushed back. And importantly, when we see the case where we have Syringomyelia, so this is the dog with Syringomyelia, this is the dog with just to say, we shouldn't diminish it, but just pain, we get a much more pronounced kinking in this region of the spinal cord. So Syringomyelia is a real extreme outcome that you get with more extreme brachycephaly plus restriction at the craniocervical junction. Some of the other changes that I'm just going to point them out because otherwise you're maybe looking at them thinking, what are there? You get a pushing in of the brain, which is represented by this green arrow. You get the olfactory bulbs becoming reduced in size and becoming more ventral. You get a reduction in the splenoid bone, which is this pink bone here. You get a reduction in the occipital crest, which is represented by this orange asterisk here. And the supraoccipital bone, which is the bone at the back of the skull, becomes shorter and flatter, pushing in at the back. So these dogs are literally being pushed in at the front, the rostral region, and pushed in at the back. And then they get this kinking of the craniocervical junction. There's also a reduction in the amount of subarachnoid space around the spinal cord, and all of these things together lead to this tendency for syringomyelia. And I'm just going to show you once again this video which kind of makes it more visual really. So this is it morphing from a dog. This is a normal cavalier, and you can see the dog on the left of the image, through a dog with Chiari malformation associated pain, going to a dog with syringomyelia, which we can see on the right of the image, and you can also see how the head shape has changed for that. This is an image showing the difference in craniocervical junction. These are two little chihuahuas that were siblings. And you can see this is the more normal chihuahua, and when you first look at this brain and compare it to the sister, you think, well, there's not that much difference. This one doesn't look as well defined, perhaps, even though it's being imaged on the same machine. But the most important thing here is this really pronounced kink, and it's hard to see on the MRI just exactly how concertinaed that spinal cord is and how tight that junction is. This is a cartoon that's been made of the CT scan of that dog, and just to point out again that you can see that there is a change in the muzzle here, so it becomes a more right-angled stop. We have a more angulation at the craniocervical junction. This bone is flatter, but it's actually reduced to the extent that it never formed in the first place. We have a membrane there. If you did a surgery on this dog, you wouldn't find a bone, you'd find a membrane. And that can fool people. It can fool people because the membrane can allow CSF around it. So sometimes people see that and they say, oh, this isn't a Chiari malformation because there isn't a cerebellar herniation. And that's why, folks, it's so important not to think about this disease as being a disease associated with a cerebellar herniation. Is a whole skull, whole brain and craniocervical junction disorder. So in actual fact, this whole brain is herniated because this dog doesn't have a back of a skull. Now I'd like to point out to you the atlas here and see how close it is to the brain, just here. It really is, in some dogs, forms part of the compression of the brain. And if the skull was continuing there, it'd be really flush with that, or perhaps this would be even indented. And compare that to the sibling where the bone comes down here, and we've got a nice space between here and the atlas. Look also in this dog at the dens. And because of this angulation here, the dens of C2, the odontoid peg, is actually pressing up into the spinal cord. It seems to be contributing to that compression. Something in humans which is called basilar invagination. I'd just like to show you some images of that in a little bit more detail. So here is a Griffon bruxellois with severe Chiari malformation and syringomyelia. And just look, this little arrow here is representing the distance between the occipital crest and the atlas. And just see how flat that is. So the arrow is almost vertical. There's no space between them whatsoever. Here is a normal Griffon bruxellois. We can see again the arrow between the occipital crest and the atlas. There's much more space here. I think you can also appreciate the difference in the shape of the skull as well. And then just for comparison, here's an Australian Terrier, another small wire-haired breed, and we can see there is really a much greater distance. Here's another Chihuahua. This dog was reported actually by another as not having Chiari malformation, and this is because they just didn't appreciate that this is where the skull stopped. See here, and that this has been is part of the occipital bone, which is still a membrane, just never managed to form that bone because of the pressure that bone was under, and the bones of the membranous part of the skull only form fully when the brain has stopped growing. Up until, whilst the brain is still sort of expanding, they are membranes, and we call those fontanelle in babies. But they should eventually fuse. But if they are so far apart, if the fontanelle is so big, then those membranes will remain membranes for the rest of the animal's life. So now look at this atlas here. See, it's right inside the skull. And that's why CT can be actually quite useful in these dogs. It ends inside the skull. If this bone had come down here, it would be ending here. And so this is really severe compression, tightness in this area here, and we can see the syrinx in this dog as well. And look again how much a reduction in the facial tissue this dog has. It literally is going skin, bone, brain. In a normal circumstance, you should have, as in this Australian Terrier, you should have a great big frontal sinus here in front of your cranium. But in these brachycephalic dogs, which we've selected to have this rounded forehead, we literally have their rounded forehead is actually the skull, which is covering their brain. Something which is a sort of bit of a sideline really of interest, really does need, although it's an interest, it needs more investigation, is whether or not these dogs also have sleep apnea or sleep disordered breathing. And the reason why that's so important is the cerebrospinal fluid lymphatic drainage is much more active in sleep, and that's why sleep is so very, very important for clearing toxins. And also the main driving force of cerebrospinal fluid through the ventricular system is actually respiration, not the systolic pulse. And brachycephalic dogs with Chiari malformation often have upper airway issues, of which the mildest only is snoring, and snoring is not normal or cute in dogs. It's a sign of a sleep disorder. But more extreme, the dogs may actually have difficulty respirating. And a lot of these dogs have a number of disorders. So in the first panel, you can see that this dog here has a nasal deviation, so there's no nasal cavity abnormalities and reduction. So this is the nasal cavity in a German Shepherd. And we have a dividing line going between it called the septum. All of these dogs that I have looked at on CT, and I mean all, I haven't found one that doesn't have it, will have a degree of nasal septal deviation. So this is the septum coming along here, and in this dog it completely deviates. So for this dog, this part of the air chamber is not making any connection with the nostril, and this affects these dogs' airflow. And I just wanted to show you how the respiratory system is compromised in these dogs. This is a German Shepherd morphing to a Bulldog. And what I want to show you is how the yellow area, which is the nostril, gets sort of even pushed up vertically, and there isn't any airflow through this nostril. there's a bit of air which is represented by the black, but there's no air going through. We have some air here, but we have this massive soft palate obstructing the airway here, and this massive big tongue. Interestingly, bulldogs don't seem to get Chiari malformation because they have a very different shaped skull. So although there is a shortening here, they don't have the reduction in the back of the skull. I'm just going to show you that that video again when I can. Come off the laser pointer, and you can see here, just watch how the different things change. And so the point is that with these dogs have essentially a 2-pound tongue, soft palate, nasal system put into a 1-pound mouth. Here we had this video in the last lecture, and it's just to show the changes with the Chihuahua that we saw in the last video, and we can see with the yellow arrow how the soft palate is changing. So these dogs can often have a thickened soft palate, but importantly it's probably the change in conformation as well, which is quite important. So what is the pathogenesis of Syringomyelia? How does that fluid actually get into the spinal cord? Well, this is the bit which is most debated, and what I'm going to do is give you the theory which is the most accepted, and leave it at that, because there are a number of different theories, and I've put down the reference here of that most accepted theory, which is actually 10 years old now. So what this basically says is that in normal circumstances, the CSF pulse pressure and the arterial pulse pressure should hit the spinal cord, represented in yellow here, and the cerebral and the space containing CSF, the subarachnoid space, at the same time, because there's no obstruction to the system and it's a low pressure system. But if you have obstruction at any point, but particularly at the foramen magnum, the so-called big hole at the back of the skull, the Craniocervical junction, then this will mean that the CSF pulse pressure is obstructed, and it may hit the blood vessel space when just after the arterial pulse pressure, and so there will be an arterial pulse, boom. And after the arterial pulse, the whole system here, will be at lower pressure, and the arterial artery is surrounded by a virtual space, which is called the Virchow-Robin, or the periarterial space, and it's very, very small. But it's a kind of reflection of the meninges into the spinal cord, and it carries this blood vessel in with it. And there's normally a little bit of fluid in it, and you can certainly see it on a microscope. So in normal circumstances, we have boom, the CSF pulse pressure hits at exactly the same time as the arterial pulse pressure. But if this was obstructed, then we have the arterial pulse pressure, then it's gone, the system is at low pressure, and then the CSF hits. This system is at low pressure, and therefore fluid is forced into the Virchow-Robin or the periarterial space, sort of like a suction mechanism, drawing the fluid in, like a sort of one-way valve, because there is this mistiming of the CSF pulse pressure and the arterial pulse pressure. Syringomyelia doesn't develop all the way through the spinal cord, and it tends to develop in certain sites first. When you have obstruction at the Craniocervical junction, then it tends to form at the C2, C4 area, just at the cranial part of the spinal cord, and then at the Craniocervical junction, and then at the thoracolumbar area. So you have one sort of pocket that develops at the top of the neck, one pocket that develops at around C7 to the T2 region, and then another pocket that can develop in the thoracolumbar region. This is not all dogs. Some dogs will just have a pocket in the cervical region, but it's extremely rare for there to be a Chiari-like malformation and there not be a syrinx in the cervical region, but for there to be a syrinx in the thoracic or lumbar region. The possible exception to that are some dog breeds such as French bulldogs and some of the other very brachycephalic breeds that are and flat-faced breeds that are predisposed to Syringomyelia. They seem to have a tendency to get a larger syrinx in the thoracic region and may have a really minimal syrinx in the cervical region, just a little bit of a dilatation of the central canal. And this is a bit of an ongoing work at the University of Surrey, where I'm based. And we've, I say ongoing in that we've only done the computer measurements in cavaliers, and what this has shown that the conformation, i.e. the shape of the spinal canal in the cavalier, which is this sort of gentle S shape, means that there's more points of stress at these areas of curvature, and that is why we get the syrinxes forming at this site. And if the dog is very severe, then eventually these pockets will all join up, and that's what these graphs are basically saying, is that these areas of stress. And if you want to read more about that, then that's the paper. This computer modelling that has been done in collaboration with my colleague Sir Syringomyelia and also Rob Lloyd, who was a master's student at the time, we've also modelled how syrinxes progress, how they get larger. And what that shows is that there is a slosh effect. Now, actually, this is not a new idea. This is actually something that Bernard Williams, who was considered really the godfather of Syringomyelia, this is something that he came up with, and we've now proven that hypothesis. Basically, what happens is that you have fluid surging within the syrinx. Now, in this MRI scan here, what we see is this black area or dark grey area in the syrinx. And what this is actually is an artifact. This is fluid. This is moving at high velocity. And the reason why it's dark is that the fluid has moved on by the time the MRI image was obtained. And so what we see here is this high, fast-moving fluid. And what that fast-moving fluid does is it sloshes up against the ends of the syrinx, and so it expands the syrinx up and also down, a little bit like if you were making a sandcastle and you threw some water into your moat of your sandcastle and it sloshed round it, and it ate away at the walls of your sandcastle. So this high velocity fluid is doing further damage. And this was the dog at 8 months of age, and this is the dog actually at 3 years of age, and we see a much larger cavity because the syrinx is much expanded. Interestingly though, the dog had more clinical signs at this age than it did at this age with this large syrinx. And you can actually see that the brain is at higher pressure here, because look how you can't see the sulci and the gyri in this dog. You can't see any of the folds of the brain, and you can here. So actually in this system, the dog has formed this very large syrinx, and actually the whole system is at lower pressure once this end stage syrinx has been formed. That is to say, the dog will still have some clinical signs because of the damage to the spinal cord. So that's how syrinxes progress, and eventually you can get what's called a hollow cord Syringomyelia, where you get a syrinx going all the way from one end right the way down to the end of the spinal cord. However, it should be said that is not the case with all dogs, and it seems that that the syrinx will have a very rapid period of progression, and then it seems to reach a kind of steady state, and then the syrinx can remain very stable for years. But that really is a subject for another YouTube lecture, and so I'm going to end at this point here. So I hope you found that video on the pathogenesis of Syringomyelia, and specifically the filling mechanism, interesting or useful. It's actually a really complicated subject, so if you didn't understand it, then I would be completely sympathetic. I do have a website that has some links to some useful papers that I've tried to, for at least one of them, which is a paper published in Practice, make it as easy to read as possible. And that was very kindly sponsored by Cavalier Health, which is a charity in the United States. And I'm also going to put the link for that in the blurb for this YouTube video. If you liked this, then there will be more content on the clinical signs of both Canine Chiari and Syringomyelia, and a little bit on how to interpret MRI scans if you're doing that, how syrinxes progress, and the genetics and breeding advice. Until then, thank you very much.